Hello, I'm Sue Brenan, pharmacist with RxCo Pharmacy, and I'm here to give you a pharmacy update on OTC cough and cold products for infants and children. On January 17th of 2008, the FDA issued a public health advisory for parents and caregivers, and they recommended that over-the-counter, which are the OTC cough and cold products, should not be used to treat infants and children who are less than 2 years of age. And this is because of serious and potentially life-threatening side effects that can occur from such use. The American Academy of Pediatrics and the CDC, which is the Center for Disease Control and Prevention, have also issued statements cautioning parents and caregivers. And this follows the FDA's recommendation from last fall, where we had a voluntary removal of the OTC cough and cold products from the market, the products with pictures of infants, and any labeling for use in children less than age 2. And this recommendation was based on finding that there was not evidence that the pediatric cold medicines really provided any relief to children suffering from colds, and there were growing reports of rapid heart rates, loss of consciousness, convulsions, and even deaths associated with their use. And all pharmacies got mailing from our wholesalers, and we had lists of products that had to be taken off. Most medicines have not been specifically tested for safety in children, and it was only until recently we trusted that the OTC medicines were basically safe for children as long as we were careful to give them in small doses. But when the experts reviewed the evidence for antihistamines, nasal decongestants, and cough syrups, they did not give them a very good report card. The cough and cold preparations are good examples of how medications that millions of people can use without worry may become unexpectedly lethal. A strong reaction to antihistamines could include any of the following reactions: confusion, behavior problems, and this is particularly important in children less than 2. A behavior problem might be the first sign that you would see that something is off. Often children less than 2 don't have the ability to communicate very well about what's wrong. Other system issues could be constipation, blurred vision, inability to urinate, dry skin, and overheating. Decongestants, on the other hand, can speed the heart rate, raise blood pressure, cause sleep and behavior problems. I agree with these guidelines. If a medication is not very effective, and it's not worth any risk, however small, especially with our infants, whose side effects can be unpredictable and more severe than in older kids. As we say in the trade, first, do no harm. As this is now cough and cold season, the FDA again is cautioning parents and caregivers against the use of OTC cough and cold products in children less than 2 years of age. There was some concern that parents may have not heard the initial warning, may still have some of the products in their homes even though they're no longer on the pharmacy shelves, and may continue to give infants the OTC remedies. So, what's a parent to do? How is anybody going to get some sleep in this house tonight? Do we close the medicine cabinet and let your child's cold run its course? First of all, infants who have cough and cold symptoms should be evaluated by their pediatrician or other healthcare provider. A persistent or productive cough in any age should require evaluation by physician or other primary care provider. Secondly, I know as parents you always want to find a way to make your kids feel better. In this case, it may be better to stick to TLC instead of OTC. There are many non-pharmacologic measures that can be used. Keeping an infant in an upright position can enhance nasal drainage. So positioning your child, especially at night, so that his or her head is lifted higher than usual. This can be particularly helpful for a baby who is breastfeeding. Also, maintaining adequate fluid intake. Have your child drink plenty of fluids. Increasing the humidity of the inspired air. Try a humidifier in your child's room, or help your child to take a hot, steamy shower. Irrigating the nose with saline drops and clearing mucus from the nasal passageways gently with a bulb syringe can also help. There are some products now coming out helping sinus relievers, and I've even seen some infant atomizer type products coming out, so look for those. If a child has an earache, acetaminophen or plain Tylenol can help. Please check with your caregiver for the appropriate dose. Trying a heating pad for a short period of time or a warm compress against the ear, this could be surprisingly soothing. Do not let the child sleep on the heating pad, however. That could be dangerous. Again, acetaminophen for a sore throat, a little Tylenol, checking with your caregiver for appropriate dose. Throat lozenges are not safe for children under 3, as they could choke on them. Of course, hugging and holding your children can comfort them. Often they really want to be comforted by their parent, caregiver, when they're not feeling well. Of course, be sure to wash your child's hands and your own hands often, and this will avoid passing the cold on to others. Interestingly enough, there was a new study published in the Archives of Pediatric and Adolescent Medicine that suggests that honey may be a safe alternative for easing a child's cough and improving sleep difficulties that are caused by upper respiratory infections. Honey does have antimicrobial and antioxidant properties, as well as demulcent, which means soothing activity, and this soothing activity can help irritated mucous membranes. Although honey does not harm older children and adults, honey can contain bacteria that can cause botulism in infants. So babies under 12 months should not be given honey. And therefore, only consider honey as an option for treating cough and cold symptoms in children over the age of 1 year. With respect to children aged 2 and older, the FDA is currently still considering the proceedings of a recent pediatric cough and cold advisory committee, and further guidance on this matter will be forthcoming, probably by this spring. In the interim, parents and caregivers who wish to use OTC cough and cold products for children aged 2 to 11 years are advised to do the following. Carefully follow the directions on the product label and use only the measuring spoons or cups that are provided or specifically made for the administration. I have an example. You will be able to see now on the number of products that are coming out. Children aged 2 years of age or under, it says ask the doctor, and then it'll give specific dosing directions for the other age groups. And I caution you not to use household spoons. They're not useful in measuring the exactness you need when it comes to measuring medicines. Please use a dosing device, medicine dropper or spoon that is available either at your grocery or local pharmacy. Again, check the active ingredients on each product. Multiple products can have the similar ingredients, and if you're using more than one product, you could get duplicate ingredients among the preparations, and combining them can increase the risk for an overdose. Select the OTC cough and cold products with child-proof safety caps when they're available, and of course keep them out of the reach of your children. And also understand that the OTC cough and cold medicines do not treat the cause of the symptoms or really shorten the duration of illness very much. They can only relieve some associated symptoms. These products should never be used to sedate a child or make them sleepy. Now finally, remember that TLC is the greatest balm for discomfort. Love, tenderness, some back rubs, and kind words. It can be a great comfort. TLC is surely the greatest placebo known to mankind, and that's a good thing. It has no known side effects, doesn't cost a penny, and has plenty of emotional and physical benefits. For more information on product safety, both for consumers and health professionals, it's available at www.otcsafety.org.